In this video, we review the updates to Continuum version 3.0. These updates are designed to improve your clinical interview experience. They include changes to question structure, expanded question response options to select from, and additional guidance for making these selections. In the General Information section, the question, "Have you been in a controlled environment in the past 30 days?" now includes prison as one of the response options available in the drop-down menu. Also, for the question, "Has the patient been released from a penal institution within the last 6 months?" the time frame has been revised from 14 days to 6 months. This update aligns the time frame with the current federal regulations for opioid treatment programs. In the medical history section, several question and response updates have been made. Navigate to the first question, "What physical or medical problems have you had of any kind?" This question has been updated so that the interviewer asks the question to the patient directly. Navigate to the question, "Do you have any sexually transmitted diseases? Have you been tested for any of these in the past? When were you tested?" The list of response options now includes whether the patient has been tested for sexually transmitted diseases. Navigate to the question, "Do you have a tuberculosis infection or TB?" Have you ever been tested for TB? When were you tested? A new response, "Not tested/not sure," has been added. This response is reflected on both reports. In the critical items section of the summary report, you will see the statement, "The patient has not been tested for or is uncertain about the possibility of tuberculosis. Therefore, consider whether the patient might benefit from a medical evaluation." In the problem list of the narrative report, under Dimension 2, the response, "Not tested/not sure," has been indicated for the TB question. Back in the assessment tool, navigate to the question, "Do you receive a pension for a physical disability? Exclude psychiatric disability." If the answer is yes, a new question will appear asking for the disability for which the patient receives a pension, SSI, or disability payments. 3 medical questions are gaining a new response option, "Unable to assess." These questions include, "How much medical or nursing care or physical rehabilitation do you need?" "How would you rate the patient's need for medical treatment?" And, "Is there a reemergence of acute symptoms that can be safely addressed only in a medically monitored setting?" The updated guidance on this question now indicates that selecting the yes response may escalate the final level of care intensity and/or require biomedical enhanced services. A response of "Unable to assess" will appear in the problem list of the narrative report and in the critical items section of the assessment report, stating that the interviewer was unable to assess the information asked in these questions and recommending further evaluation. Question and response updates have been made to the drug and alcohol section. In the Used Substances subsection, the response box has been updated. Ecstasy is now reclassified as a hallucinogen. In addition, the language has been updated to ask the patient in a broad sense about the types of substances he, she, they are using and prefer, or that are considered problematic to the patient. Previously, this question asked about all of the substances the patient has ever used. To capture information about lower priority substances, navigate to the Alcohol and Drug Interviewer Rating subsection. Then scroll to the bottom and use the comment box to provide details. Back in the Used Substances subsection, if you have indicated the patient has a history of using tobacco or other nicotine-containing products, including electronic cigarettes, click on the Nicotine and Tobacco Use subsection and navigate to the question, "How did you most often or most recently use tobacco and other nicotine products?" The Smoke response option has been expanded to Smoke/Vape to more accurately depict the route of administration for individuals using a vape to ingest tobacco or other nicotine products. Navigate to the Additional Addiction and Treatment Items subsection and scroll down to the question, "What might cause you to relapse in the future?" The first response option now reads, "Has detailed and comprehensive sense of the role of treatment versus need for personal efforts, or no relapse risk likely." Hover over the information icon for guidance in choosing the appropriate response for a broader range of patient circumstances. Navigate to the Family and Social History section. For the question, "What are your usual living arrangements past 3 years?" you may now select multiple responses. In the same section, 2 questions now include an additional response option of unknown. Those questions are, tell me about alcohol and drug use among your friends, how will your friends affect your treatment and recovery, and how will you deal with any problems with friends and acquaintances who put you at risk for relapse? What is it like for you to meet people who can help in your recovery? Navigate to the question, how much help will this person or these persons need to assist in your treatment and recovery? And how likely is it that he, she, or they will get involved in your treatment? Hover over the information icon to view additional details on each response item and guidance in selecting the options that best reflects the patient's situation. Next, navigate to the question, are you able to locate and get yourself to community resources safely? The response options now include more nuance, no or unknown, and yes, or a patient is remaining in a residential or controlled environment where resources are available. Additionally, the question asking how much staff support is needed for a patient transitioning back to the community now offers the response option, needs contact approximately 1 time per month, to provide greater specificity. In the psychological section, select the subsection Psychological History. Scroll to the question, what psychological or emotional problems have you had? Now included is a new question asking if the patient has had any problems with mood, sleep, energy, nerves, eating, thinking, memory, or getting along with others. This allows you to begin collecting data about psychological and emotional symptoms. Additionally, a new response option, cognitive delays, developmental delays, or borderline mental function has been added. Updates were made to several questions about suicide risk. For the question asking about suicide attempts, response options above 0 or not at all now provides greater detail to help the interviewer determine severity of risk. Info icons have also been revised to include broader guidance in determining how to respond to the question asked. Navigate to the psychological interviewer rating subsection. For the question, will the patient be able to safely access the community for work, education, and other community resources? A new response option, no or not applicable, has been added. The same update exists for the answer options of the question further down in the assessment tool. Can patient access services such as assertive community treatment and intensive case management? The info icon details have been updated for this question to describe assertive community treatment. A similar update has been made for the question, are current problem behaviors so severe as to require continuous limit-setting interventions? The info icon now describes limit-setting intervention. In the interview completion section, a new response option of not applicable has been added for the question asking about whether the patient would recommend the treatment program to a friend in need of help.